Gentleman from Gloucester, Mr. Morgan.
Mr. Speaker, I would request that House Joint Resolution 291 be brought up out of order.
Clerk will report a resolution.
Mr. Speaker, page 15 of the calendar, House Joint Resolution number 291.
Mr. Speaker, if I
Gentleman
may make an announcement
Gloucester.
before he reads the resolution.
Okay.
Mr. Speaker, ladies and gentlemen of the House, I'd like to say that in the gallery today we have Pat Finnerty, his wife Carol, sons Ryan and Sean, his sister Kathleen, brother Danny, and along with them the Commissioner for the Virginia Department of Aging, Linda Nablo, the DMAS Acting Director Cindy Jones, Deputy Directors Cheryl Roberts and Scott Crawford, as well as DMAS Executive Assistant and Management Team and numerous supporters of Pat Finnerty. And with that, Mr. Speaker, I would ask that the resolution be reported.
Clerk will report a resolution.
Yes, sir, Mr. Speaker. Page 15 of the calendar, House Joint Resolution number 291, commending Patrick W. Finnerty. Whereas Patrick W. Finnerty recently completed a 32-year public service career with the Commonwealth of Virginia, marked by innovation, transformation, and persistence. And whereas a native of Milwaukee, Wisconsin, Pat Finnerty was born on July 6, 1955, to loving parents Martin and the late Arlette Finnerty. He received a bachelor's and a master's degree from Virginia Commonwealth University and is a member of the Phi Kappa Phi National Honor Society. And whereas Pat Finnerty's state career began in 1978, cutting his teeth on the nuances of state government service with positions within the Department of State Police and Department of Planning and Budget. And whereas from these early experiences, Pat Finnerty carried forth a solid understanding of the mechanics of state government to the Virginia State Employee Health Plan, where his career took an auspicious turn in the world of health care, with the Commonwealth benefiting ever since. And whereas as a director of the State Benefit Program for over 4 years, Pat Finnerty steered the program into the managed care arena with determination and diligence. And whereas despite initial resistance to his new approach to delivering health benefits to state employees in the Commonwealth, the resulting program, Key Advantage, quickly became a model success throughout the Commonwealth. And whereas Pat Finnerty joined the staff of the Virginia General Assembly's Joint Commission on Health Care in 1994, serving for 8 years, including the last 3½ years as Executive Director. And whereas Pat Finnerty's exemplary leadership and collaborative approach to health policy issues during his tenure at the Joint Commission on Health Care were marked by numerous accomplishments, including the Commonwealth's implementation of the Federal Health Insurance Portability and Accountability Act, HIPAA, and the State Children's Health Insurance Program, SCHIP. And whereas in 2002, Pat Finnerty was appointed Medicaid Director, and for the past 8 years, Pat Finnerty has offered extraordinary leadership and demonstrated a steady and strong hand at the helm of Virginia's Medicaid program. And whereas under Pat Finnerty's direction, Virginia's SCHIP program was reformulated into the Family Access and Medical Insurance Security, FAMOUS program, and whereas the FAMOUS program has been recognized nationally for its outreach efforts resulting in the provision of health care to children in need, and many of the program's best practices, such as improving enrollment and re-enrollment processes and increasing access to care, has served as a national benchmark. And whereas Pat Finnerty led an effort to reform the dental care delivery model for children under Medicaid, and whereas through his typically deliberative and inclusive approach, Pat Finnerty worked with stakeholders to develop a new dental program called Smiles for Children that has received national acclaim as a model to be emulated by other states. And whereas thanks in large measure to Pat Finnerty's leadership, the results of the new dental program have been remarkable, with the number of participating dentists nearly doubling and the percentage of eligible children receiving dental services increased at approximately 60%. And whereas Pat Finnerty has volunteered his time and talents on a regular basis, including with the Virginia Dental Health Foundation's Mission to Mercy Mom project in remote and underserved areas of the state. And whereas for all the numerous accomplishments and their positive impact on the lives of Virginia citizens is a genuine care for those affected by his work that truly sets Pat Finnerty apart, and that passion to assist those in need is what those with whom he has worked over the years often most cite as his greatest strength. And whereas Pat Finnerty's calmness, thoughtfulness, responsiveness, and good humor will be greatly missed by the members of the General Assembly, staff at the Department of Medical Assistance Services, providers, consumers, advocates, and all healthcare trade associations. And whereas Pat Finnerty has been supported in all of his efforts by his loving wife, Carol, and their 2 sons, Ryan and Sean, he looks forward to continuing to travel to Key West, Florida, watching his favorite football teams, the Green Bay Packers and Notre Dame, and having time to pursue woodworking. Now, therefore, be it resolved by the House of Delegates, the Senate concurring, that the General Assembly commend Patrick W. Finnerty for his compelling 32 years of public service to the Commonwealth, and be it resolved further that the Clerk of the House of Delegates prepare a copy of this resolution for presentation to Patrick W. Finnerty as an expression of the General Assembly's gratitude for his longtime public service and dedication to the people of the Commonwealth.
Gentleman from Gloucester.
Thank you, Mr. Speaker. Mr. Speaker and ladies and gentlemen of the House, I've known and worked with Pat Finnerty for many years, and from that perspective, I can state without reservation that no one personifies better the title servant leader. Considering the complex balancing act involved in managing and coordinating the state, federal, Medicaid behemoth for 8 years, it's no wonder that he's tired. But he's too young, really, to retire. He's born 3 years after I graduated college. I'm confident, Mr. Speaker, ladies and gentlemen, that, and hopeful that after a period of rest and relaxation, we'll be seeing a lot more of Pat Finnerty. Mr. Speaker, he, as I say, and his family and many friends in the gallery, I'd ask that they stand, and I'd ask that I move the adoption of the resolution.
Gentleman from Gloucester, Mr. Morgan, moves adoption of the resolutions. May in favor of that motion will say aye.
Aye.
Those opposed, no. The resolution is adopted. Pat, we thank you for your years of service to the Commonwealth and sincerely do hope you enjoy your retirement. Thank you very much for all you've done.